Well, it is my pleasure and my honor on the same time to give the plenary lecture in this distinguished Jubilee Mediterranean Cardiology meeting. It is not the first time for me, it's the second or even third time, and so I'm proud really to be invited again by Michele Gulizza. Well, the title or the task of my presentation is History of Anticoagulation, from the beginning to novel oral direct anticoagulants. History is important. If you do not know the past, you cannot manage the future, as already Confucius said in ancient China. And this is true also in our days. Well, it started off with salicylate. Even the old and ancient Egypts and Greeks used salicylate, which is coming from the Egypt willow, and used salicylate against fever and other diseases. Particularly our ancestor Hippocrates, the father of medicine, used that, and we find also this mentioned in the Papyrus Ebers, the oldest papyrus worldwide. Later on, it was Aristotle, the teacher of Alexandros the Great, Megos Alexandros, who observed fibers in the blood, fibers responsible for coagulation. And later on, also Morgandi, Giovanni Battista Morgandi from Forlì, also was one of the first who observed and described a clot. So these are previous investigations concerning anticoagulation. Later on, it was aspirin made from the salicylate. This was one of the first important anticoagulants distributed and propagated worldwide as an important anticoagulant. It was invented 1897 by Felix Hoffmann, the first German patent, and the US patent in 1900. And the first advertising there was written, does not affect the heart. Today the situation is different. Without aspirin you cannot be a cardiologist. Well, then we had other important developments. It was 1915 as it was J. McLean who found anticoagulants in dog liver. Liver, hepa, the name was heparin, and that was synthesized later on by Howell and Holt, 1919. And then some years later, 1922, there was a cow disease in Canada, the sweet clover disease in Canada, Alberta, because of fermented sweet clover. And at that time, many cows and cattle died because of this inadequately stored and fermented sweet clover. It was 1941 that Paul Link isolated warfarin. Warfarin, one of the leading vitamin K antagonists. And then some years later, also the new oral anticoagulants came available. First, the antithrombin dabigatran, and later on the factor 10A antagonists, and the first antagonist was rivaroxaban. And in our days now also apixaban was present. So we have looking on the novel oral direct anticoagulants, three substances: dabigatran as an antithrombin, and rivaroxaban and apixaban as factor 10A anticoagulants and antagonists. And these substances have many advantages. All three are superior to warfarin as far as stroke, myocardial infarction, and death is concerned. And as I told you, rivaroxaban was the first and 10A antagonist, and dabigatran the first antithrombin, and apixaban was approved only some months ago. But with these new substances, there are many advantages for the physician as well as for the patient. And if you ask me, is this a new era because of the new inventions and the availability of these new drugs, then I must answer yes. It is a new era, and I'm very confident that the physicians are now in a better situation to treat the person and the patient, of course, to avoid stroke. And it is also important for the brain to avoid stroke and keep the blood fluid in heart and brain. I think these are some important aspects concerning my lecture. Of course, I will go in detail and will tell the audience many things more, but I think you have some words and some ideas what is happening now.